Some of the scenes that shocked the world. The Ebola outbreak took a terrible toll on the people of Sierra Leone. More than a year has passed since then, but the victims aren't forgotten.
Fellow citizens, today, as we pause again to remember the thousands of Sierra Leoneans who lost their lives to Ebola, we must also remember the sense of national unity that we rediscovered during that period.
8,704 people were infected during the outbreak. 3,589 died. 221 of them were doctors and health workers on the front line of the fight against the virus.
It's terrifying. When I started getting the symptoms, and the morning when the ambulance came for me, with the siren and that kind of thing, my son started crying. I felt, I also cried because you think you're going to die.
Dr. Mbrian is the only medical doctor who survived the virus here. Part of the military medical response team, he contracted the virus in November 2014 here in the capital, Freetown.
The outbreak caught us really with our pants down, and we had little or no knowledge about the disease. So it was kind of like in disarray.
That lack of knowledge and the stigma surrounding the virus proved deadly. Patients would be transported to Kenema Hospital, often without the proper protections in place. At the time, Kenema was the only facility with a laboratory and an expert capable of testing for Ebola.
Dr. Sheikh Umar Khan, may so rest in perfect peace, was a virologist, and since he passed away, I don't know of a specialist in virology.
His death was a major blow to the country's efforts to fight the outbreak. Now, though, Sierra Leone is making sure it's not caught unprepared again.
We have specialized, and we still have some in training. And I believe with time, we'll have more doctors going to specialize.
Monkey Bush is about an hour's drive from Freetown. This was one of the areas that was hardest hit during the Ebola outbreak. A lot of children were orphaned, but it's such a close-knit community that women you see behind me took some in.
My name is Adama Koroma. I adopted twin girls whose parents died of Ebola. My husband lost his parents. We felt for them, so we took them in.
It's a densely populated neighborhood, mostly Muslim, which proved to be a challenge.
We believe that if you wash the dead and dress them, that is when they are presentable to the Almighty God.
The contact with the bodies spread the virus, and authorities banned the practice of washing the dead. The ban remains in place. You'll also hear sensitization programs on hygienic practices on radio stations. Still,
some people follow the practices like washing hands, but there are those that don't.
Flights were banned at the country's main Lungi airport at the height of the crisis. The only people coming in were health workers. Now, though, with the Ebola crisis over, Sierra Leone is more than ready to move on.
Well, we are seeing, very encouraging figures for international arrivals, and our earnings from tourism, according to the National Revenue Authority, for this year has improved after Ebola. We're hoping that as we go ahead, we'll double or triple those figures.
It's a country that was essentially locked off from the world for nearly 2 years. Through their resilience, Sierra Leoneans survived, and they are ready to more firmly rejoin the world. Kathryn Omwandho, CCTV, Freetown, Sierra Leone.